So if somebody suspects that they have lymphedema, what steps should they take?
Okay, ideally they should consult with someone who specializes in lymphedema. In our country, there's really not many. There's about 3 or 4 surgeons that currently has a special interest in lymphedema, but a good place to start essentially is any GP or any doctor that can start the process. A patient needs a thorough history taking and examination, and then you need certain tests to prove the lymphedema, because there's many reasons for swelling. So you need to prove the lymphedema, and for that there's nuclear lymph scans that can look at the lymph component of a limb and comment on whether it's diseased or not. And then some of the newer options, one of the machines that I have is an indocyanine green fluorescent camera, and it uses a special contrast that we inject under the skin, and it essentially has a fluorescent camera that you shine onto a limb, and it shows how the lymph takes up this contrast. It gives you different kinds of patterns, and it helps us to grade the lymphedema and also then to decide on what kind of treatment option is most appropriate for a particular patient. If you have these linear tracks going up, that's good lymphatics. And if you see, we've injected it like a minute ago. You can see there's a fair amount of lymphatic transport already. It's already at her elbow. So you can see there's a fairly rapid transit time of the contrast. So it means it's good functional lymphatics. That's what we want.